Hey Tim, how are you?
Very good. How are you?
Good. Happy Wednesday.
Happy Wednesday. I'm on the north side of campus and it looks like it's going to rain here in a
I
little bit.
just looked out the window. It looks the same thing. Yeah. Looks
Super
like something's going to
excited.
happen.
We've been getting I love this monsoon season.
I
It's
know.
it started early. It's been going strong.
It's really beautiful, actually.
We're going to wait for a few people to roll in. I can see our participants coming in. Um,
Sure.
and I'm going to share our screen
Awesome.
for
Thank you.
our town hall. And I'll drop off here in just a few minutes, but we can start whenever you're ready. It looks like we have 180. We're
Oh,
getting
wow.
close to 200 people on. So I'm going to
Cool.
drop off, and whenever you're ready, you can get started.
All right. Thanks, Tim. I appreciate it. Good afternoon, everybody. Happy Wednesday. Happy last day of July. I hope everybody's doing well and having a good start or midway point to their week. I'm Jennifer Mendrzycki. I'm the president and CEO of TMC Health, and I'm very happy to be with all of you today to give you a few updates on some system things that are going on, just so you can be in the know. And we'll get right to it. So, beautiful picture there. Thanks, Tim. Tim took that picture. Thanks so much. It's actually absolutely beautiful. It's a picture of one of the monsoons. So let's talk a little bit about what we're going to talk about today. So, oh, there we go. So a little bit on our agenda today. We've got some new leaders that we have that have joined the organization. So we want to call them out and let you know who they are. And then we're going to talk a little bit about some of the recent surveys that several of our facilities have had. A couple of visitors, both from the state as well as from our deeming body from the Joint Commission. So wanted to be able to let you know about that. I'm going to ask Alex Horvath to join me and talk a little bit about the employee engagement survey. I've also asked him to do a little bit about a Meet Alex. So if you remember the last time we met, I told you a little bit about myself. And so I thought it might be nice if we asked all of the other executives that help join me on the monthly meetings to tell us a little bit about themselves so we get to know them as well. I'm going to talk very briefly about confidentiality, and then we're going to talk a little bit about awards, recognitions, and celebrations that are going on across TMC Health, and a little bit about TMC in the news. I'm sure it's going to be an article and a video that you are all probably familiar with at this point. And rounding it out, it's a little bit about back to school. I can't believe it's that time already. So we'll finish with that. So if you want to move, thanks so much. Thanks, Tim. So a few new faces around TMC Health we wanted to make sure you were aware of. Ashley Teeters has joined us in the past 2 weeks. Ashley has joined us as the VP of Revenue Cycle for TMC Health. She is joining us from the University of Chicago Medical Center, where she served as the Executive Director of Revenue Cycle. And we are very excited to have her here with us out in Tucson. I know that she has made a home here already and is very excited to be out in Tucson and with TMC Health. So thank you, Ashley, for choosing us and for coming to join our team. And we look forward to working with you. And the second person I wanted to introduce is Doug Womer. Doug will be the interim CFO for Tucson Medical Center. Very happy to have Doug with us as well. Doug is coming to us in an interim capacity from Texas, and he's served in the healthcare industry in both CFO and Chief Operating Officer roles for many years. He was most recently operating an independent consulting practice with clients across the country. And we are very excited to have Doug with us and his expertise as we move to find a new CFO to replace Kevin Kilday, who is now moved back out to Boston. And we are very excited for Kevin. We miss Kevin, but we thank him for everything that he's done for TMC and for the entire organization. And we are very happy that he is going back home and being with his family and doing what he wants to do and what he loves to do. So if you could move to the next slide. Thank you. So a lot of visitors we've had around TMC Health in the past couple of weeks. Tucson Medical Center and TMC Rincon had a visit from the Joint Commission. It was their triennial survey. I want to congratulate the teams at TMC, TMC Rincon, and TMC Hospice. All of them participated in the Joint Commission survey. They all did incredibly well. I know how tiring surveys are and how much work goes into a survey. And so just want to thank everyone on all of those teams for all of the work that they have done to make it successful. Always good when the surveyors call out our employees and our staff and tell us wonderful things about them. We already know those wonderful things, but it's nice to hear others say it too. And certainly this was no exception. The surveyors noted that everyone was very engaged and very responsive. And that's great to hear. We want to improve, and we want to make sure that we're doing things correctly and keeping our patients safe. And so we appreciate it when the Joint Commission comes out to survey us, even though we know it's a little stressful. And patients gave glowing reviews to the surveyors, and that is even better than hearing from the surveyors good things from the surveyors themselves, because the patients are the ones that matter, and that's why we do what we do every day. So thrilled to hear that all of those surveys went well, and congratulations to all of those teams for that hard work. Northern Cochise Community Hospital was the recipient of a visit from the Arizona Department of Health for their survey. And the surveyors there also had a lot of wonderful things to say about the team. Excellent and well prepared. I know that they worked hard too for that survey. I know how much work goes into that. So a big, big congratulations to Mo Sheldon and the entire team at Northern Cochise Community Hospital for a successful survey from the Arizona Department of Health. All right. I am about to turn it over to Alex, our TMC Health Senior VP and Chief Human Resources Officer. And I had, as I mentioned earlier, I started my journey here at TMC Health by sharing a little bit about me. And so I thought it might be helpful if each of the executives gets to share a little bit about themselves. So I will leave it to Alex to do that and then walk us through the employee engagement survey.
Thank you, Jennifer, and good afternoon, everyone. Hello, hello. I've got a couple of pictures I think that Tim is going to put up here slowly that's kind of tells a story. Well, I'm from Chicago, and those of you that don't know me, I'm been a pizza connoisseur, love pizza, and it's deep dish from one of the restaurants there that I do love the most. So that's a lot about me. I love my job here at TMC. I love TMC. And where else can you make such a difference every day as part of a team that is serving the community? So I've worked in a number of healthcare systems. Actually, this is my fifth over my career. And really, you are, and this team is the most engaged employees that I've ever and focused on our patients that I've ever encountered. A little bit more about me. So Gino's East is my favorite pizzeria in Chicago. My wife, Connie, and I have 3 children, all live in Tucson, and we enjoy the sports in Arizona. So we enjoy all of the Wildcat teams. And I coach youth soccer. I have coached basketball and baseball. Currently have a team in youth soccer. And my daughter is a nutritionalist, but she also coaches girls soccer at Catalina Foothills. And then finally, really all of our kids live here. And so we've had the opportunity to have all of our grandkids and their cousins live in town here. And getting to know people and throwing pizza parties in the backyard is one of our little pastimes. So that's all about me in 1 minute. So that's it. Fabulous. Thank you.
Great job, Alex.
Thank you. And now we want to move a little bit to a little bit more serious subject, which we are so thankful that all of you who have participated in our employee engagement survey and culture of safety survey back in May. And our overall engagement score on this scale of 1 to 5, as you can see, there was 4.01. So that's an improvement for us over our 2020 survey, and then also an improvement for us over our 2022 survey. And you can see the strengths and opportunities then from the survey results on the right side. And we have some really, really great strengths as an organization. But where I wanted to spend a little time was on opportunities and the key drivers that we have. And the next slide that we have here, we'll talk a little bit about, Tim, if you want to go to the next one, our next slide, we'll talk a little bit about engagement by tenure. So this is really an interesting result, which shows the engagement by years of service here at TMC. So we have improved at every level, as you can see, except one interesting one between person here who has been here between 1 and 2 years. And that's an interesting time because between 1 and 2 years, that's also where we have our greatest level of turnover. So that really is aligned. And so we're going to look with you and all of our leaders to obtain the employee lifestyle feedback from that group of individuals to help us understand the moments and what matters most, really at each one of the intervals to help us improve our engagement for all areas of tenure, but also in this first to second year. So we know a life cycle really starts. You're recruited, you take the job, and during your very first year, you're onboarded, you have your job competencies completed, you get to know the role. But then in year two, things start to happen differently. Some people are looking for where they can develop, what are the developmental opportunities? Have I been accepted in the department? Have I made that significant other friend or colleague, and what the culture is like? And so there's where we may have some opportunities. So there may be mentors in year two. So there'll be more to come. I just wanted to do a little bit deeper dive because it's an interesting stat. And then on the next slide, these are our focus on our key drivers. So when we conduct the employee survey, we're really looking to receive your feedback and help us understand your needs as an employee and identify areas for improvement. In those areas that you see on the slide that are promote, we've done a great job on, and we're going to continue to look to get better. But then those focus areas are areas where we see the greatest opportunity. And the reason they're called key drivers, because it's where we want to focus our efforts to drive the greatest improvement then in engagement and in employee satisfaction. So we have many strengths, but we have some focus areas. And the one I want to really focus in on there is the very first one on the bottom focus. The organization treats employees with respect. Now that sounds pretty big, right? And pretty complex, but addressing this item oftentimes is not as complex as we might first think. Asking how we as an organization and as individuals really define respect is really valuable feedback, and we all probably have a different definition. So we really want to know what behaviors and organization decisions, or maybe even lack of, right, make us feel less respected. So ask you what behaviors or org decisions you need to see to make you feel respected, what specifically needs to start or stop as an organization to continue so that you can strongly agree that we are respecting individuals and employees in the organization. So ideally, you'll have this conversation with your leader when you're rolling out your team's results and meeting in your department and getting to kind of the why questions and really trying to understand what you all are thinking about. And you'll be asked about this. So this is an important one. It's different for everyone. And I just wanted, we get comments on all of the questions. And out of these 43 survey questions, these 6 are really the key drivers. And on these, we range everywhere from, gosh, greatest organization I've ever worked for. I feel totally respected. Thank you. To, gosh, I'm in the dark all the time. I don't know what's going on and no one tells me anything and I don't feel any respect. So we know there are 2 ends of the spectrum. And what we want to do is be able to move as many of our staff into the area of high engagement, the green, because we have a fair amount at 19% in this area of neutral, not sure, and then about 7% that feel that they definitely are unfavorable to the respect. So more to come on that. I know it's a lot of detail, but it's really an interesting one. And we have 4 others that we're really going to be dissecting with you to be able to improve on over the next foreseeable months and year, and actually 2 years before we get to another survey. If we go to the next slide, I'd like to offer up that we have these recommendations for our whole system-wide approach to these key drivers. And they really start then with this communication and really celebrating the successes in the particular department and as an organization. And then we will look to hear from you in each department and then create an action plan from your feedback on this very area of respect is a really good one. And then we want to, by December, we'll be doing some follow-ups on, did we do what we said we would do? And then did we accomplish what we were after, really the goal to improve in the department and organizational wide? And then how does this support our employees going forward, all of our staff going forward? So our follow-up and our action plans are as important as the original data, so that you know that this was used and that we have the opportunity to be able to say next time we survey, here's what we've changed. And then finally, we want to move forward the next slide, which is kind of a summary of who participated. So we had 33 out of 4,500 employees participate. The rate was 74%, which is just great. So we can't thank you enough as a leadership team, because the average for Press Ganey, and they survey millions of people, I think 1.7 million so far in 24, is 68%. All the key drivers have improved, but we've got those 4 that we talked about that we really want to focus in on. And then the engagement score went up about 2 points in 4.01 to 3.99. So then our final next steps to cascade the results, we presented to executive leadership. Our CEOs have had a chance to look at the information. This is our system town hall, obviously, today, to review the results and at a high level and next steps. And then each of our CEOs will initiate a rollout to staff, including town halls, review results and next steps. And then they'll have each of our departments will have department meeting and unit meetings to be able to look at what you would like to improve in your area, and then org-wide what we would like to improve. And then these plans are due back October 1st, and we'll be implementing along the way. So again, the most important thing is that we have action and that we do what we said we would do by the time we're done with our process. So we'd entertain any questions you might have, but you'll have a lot of time with your leader to ask questions. Thank you.
Thanks, Alex. I really appreciate that. And there may be questions. I just want to echo what you had to say. I just want to thank everybody for completing the survey. We know it takes time, and we appreciate you being willing to not only complete the survey, but be honest with your feedback, because as a friend of mine reminds me constantly, feedback is a gift. I joke with her that sometimes feedback is like the socks your aunt gave you for Christmas. But feedback's important because feedback helps us improve. And that is always what we're looking to do. We are looking to be better every single day than we were yesterday. And we can't do that without feedback. And feedback also holds everyone accountable. And that's part of the thing that I'm committed to is accountability and making sure that when we say we're going to do something, we do it. So really want to thank Alex and the whole team in HR for leading this effort and putting all of this together, but really want to thank all of you for taking the time to send your comments and to complete the survey, and know that we are using all of the information that you've provided to be able to improve all of us and all of the work that we do at TMC Health. So I'm glad to see the next steps, and you will see the next steps, and we will utilize this town hall in the coming months to report back on our progress around the action plans, and then see how we're doing towards those action plans as well. I don't know if there's any questions about that, Alex. I didn't see any yet, but there's certainly opportunity. If you've got any questions and you want to post them in the Q&A, that's completely fine.
There are no questions yet, but I'll remind people that in the Q&A section on the bottom of your screen, you can post a question and we'll follow up on those. There's a few in there that we can answer towards the end, Jennifer.
Cool.
The general interest questions, but the Q&A section, they can put their questions in there.
Perfect. Thank you. Thanks, Tim. And thanks again, Alex. All right, so wanted to talk very briefly about medical records and confidentiality, and why I think that this is important. And it's a good, I think, segue from some of the results that we had on the employee engagement survey. So let me explain why. Why am I talking about this right now? So when I came into the organization, I had a chance to meet with Denise Hathaway. I hope all of you know who Denise is. She's our Chief Compliance Officer. She does a tremendous job. And having formerly been in many, many, many years ago, a compliance officer, I know how hard that job is. And I had an opportunity to have a conversation with her. And she shared with me that we've seen an uptick in people accessing records across the organization. I always look at it as I put it in the light most favorable to everyone, and think that people are doing it because they're concerned about family members or about their kids, or maybe they're helping out a neighbor, but wanted to really remind everyone that confidentiality is really important. We only are allowed to access medical records when it's something that we need to be able to do our jobs. And we're only supposed to access the minimum necessary to be able to do our jobs. And so some of the things in my past life, when I used to have to provide education on this, a lot of people were always surprised about, who can and who can't access records. And you can't view or access your own medical record, which I know feels crazy, but that is not only part of our policy, but it's also part of HIPAA as well. So you can't look at your own records unless it's coming through MyChart, right? So MyChart's how our patient portal, and it's how we as patients can access our information. You can't access or view records of family members, including even minor children. So even neighbors, even friends. And there's certainly been a lot in the media in the past year or so around healthcare workers accessing records for famous people who come through their system and looking at records. So why do I bring it up now? One, because it was brought to my attention. So I want to do my best to provide everybody with education so we do the right thing. But the other reason was because as I looked at the employee engagement results, and I saw that there was one of those key drivers that Alex just mentioned around respect, right? And we have, I think, a little bit of work to do there from what we've seen on the key driver. And this kind of ties into respect. So when we respect our patients, and many of us, including me, have been patients of TMC Health in various ways or in various different facilities, we want to show each other respect and know that when we come for care, that our information is kept private, and that we are protecting the privacy of everyone in our community that we are so fortunate to be able to provide care to. So I think it ties in very well with that concept of respect. And we want our community to trust us and to come for care. And we, as both employees and as patients, want to be able to come for care and trust that our information is private. So I thought it was a good opportunity for us to touch on this today. That's a lot of words on a slide. And I know that. I think the key piece to remember is you can't look for your own information. You can't look for family members, minor children, neighbors, friends. We are really only allowed to access records and information when it's key to the work that we have to do, and it's only the minimum necessary. So if you have any questions, if you have any concerns, if maybe you'd like to have more education about it and have it come to your department, please reach out to Denise Hathaway. She'd be very happy with her and her team to come and provide any additional education or even answer any questions that you might have. And I really do thank you all for everything you do for our patients and for all of us every day to be able to keep our information secure and keep it private. I think our next slide. Oh, good. I love this slide. So awards, recognitions, and celebrations. We have a lot to celebrate, and there's a lot coming up to celebrate, which is very exciting. So September 21st will be our TMC Health Service Pin Awards. It's my first service awards. I've heard a lot about them. I heard it's fantastic. It's a great party. I'm truly looking forward to it. It's going to be held at the Tucson Convention Center in the Grand Ballroom. We're going to celebrate all of the years of service. I know there'll be more information coming out. Alex, I don't know if there's anything else I need to mention, but wanted to make sure everybody's got it on their calendar. It's September 21st. I am truly looking forward to participating in my first event, and I look forward to seeing all of you, meeting all of you there, and really giving a lot of accolades and recognition to those who have dedicated so much of their career to TMC and TMC Health. Northern Cochise Boots and Bling is September 7th. The fun just keeps going in September. So don't know if you've ever been. I've never been. Very excited to go and check it out. It'll be September 7th. It's benefits Northern Cochise Community Hospital. I know it also, talking to Mo, it benefits some scholarships for students that are down in Wilcox and the surrounding area. So if you're interested in joining us there, please reach out to the foundation and ask, and I'm sure they'll be able to give you some additional information. But I actually just put this on my calendar last week because I'm really excited to go. I think it's going to be a lot of fun. Couple of other fun things, vote for TMC Health. So TMC Health has been nominated in 13 different categories in the Arizona Daily Star Readers' Choice Awards, and you can vote for TMC Health, and you can see right there on that screen, we've got a number of different text numbers that you can reach out to and vote for all different kinds of areas: the best emergency department, best peds emergency department, best hearing clinic. In fact, when I came in earlier, I saw a poster downstairs by the elevator, and while I waited, I got to vote on the best hearing clinic. So you can do that too. Just go and text those numbers and vote for TMC Health. And we get to vote from July 28th through August 11th. And not sure when we hear about the winners, but I promise that we will bring them back here and make sure that we promote them on social media and also internally as well. So please get out and vote. We really appreciate it. And another one that I thought was great, and I talked to Gary Karchner about this as well, Superheroes in Benson. They formed a Future Superhero Academy to partner with the Center for Future America to host more than 20 kids from Benson to come to the hospital over the summer and learn about a future in healthcare, which I think is great. One of the things I've always said is a lot of times I find people who think that working in a hospital or working in healthcare is about being a nurse or a doctor. And if you don't do that, then you can't participate. And I tell everybody that is not true. There's so much to do in healthcare. Even if it's not bedside care, you can contribute in some way. And what a great opportunity to give a little bit of insight to kids on all of the various careers that you can have in healthcare and what a meaningful impact you can make in the lives of people. So thank you to the team at Benson Hospital for putting that together. I love it. Would love to see us be able to do that elsewhere too. And more fun things. So I love, Tim, that you called this arriving soon. I think that's great. So TMC Rincon is going to open up their labor and delivery unit in October. And Dr. Dean and Dr. McHenry will be there to deliver babies at TMC Rincon. And we are super excited about that. Looking forward to it. If you haven't been out there, you really should go and take a look. It's a beautiful facility. It's a beautiful place filled with a lot of people who are providing excellent care to that community. So really looking forward to the opening of that. And thank you, Dr. Dean, for your leadership out there. And thank you, Heather Beck, as well, for your leadership too in bringing that to fruition. I know we're all looking forward to October. And TMC One, coming soon, opening up a new location at the Bridges also in October. There's a lot happening in September and October. And this one will happen in late October. And we are looking forward to seeing that open and providing care in that location as well. So thank you to the entire team at TMC One. I know how hard it is to stand that up and get that going. And so we appreciate all of your efforts so we can continue to provide excellent care to the patients who need us. And so lots of things happening, and certainly a lot of TMC in the news. So I don't know if you heard, but we had a visitor, a little mountain lion, came to visit us at TMC at Tucson Medical Center, and we really appreciate the security team, everyone involved in keeping everyone, patients, staff, visitors safe. It was a united effort, and a big thanks to Game and Fish, who came out very quickly, and as well as the sheriff's office to help us with the mountain lion. I know I had people ask me, how is the mountain lion? And so I think Tim's going to share a little video with us.
Here's the mountain lion. Here's how he ended his weekend.
So a happy and healthy mountain lion was returned back to his home, which was very nice. And we were very happy to see it. There he goes. So it was a first for me. Never seen a mountain lion before. Never have a mountain lion come and visit at a hospital. So that was a first for me. And the night before that was a monsoon, which was also the first for me. So that was a good week for me. A lot of fun things happening. What I will say as a reminder is just the day ended safely for everybody, and we were incredibly, incredibly grateful for that. But just be careful before you share things to social media or out to the public before going to the communications team. So my request and my ask of all of you would be, if you want to post something, please reach out to communications and let them know so that we make sure the right information is out there. There was just a lot of rumors and a lot of back and forth out there. And I think once we were able to post about it and give information, I think it kind of calmed everybody down and everybody understood what was going on. But big thank you to everyone for keeping everybody safe, for keeping our patients safe, for keeping everybody calm, and very happy that this mountain lion got to go home safely. All right, so I can't believe it, but it's July 31st and it's back to school time already. Who saw that coming? That went very quickly. So I know we've got people who are starting school tomorrow. I know we have some that are starting school next week, and even some that are starting school the week after that. I'm sure many of us have either kids or grandkids that are going back to school. Maybe you're going back to school. And if you are, congratulations to you. I love the lifelong learning. That's fantastic. But I know it's back to school time. It's both exciting and it's also always a little bit nerve-wracking, right? Because especially when there's a new beginning, right? So I have a new beginning now. My daughter's coming out in another week and she will start school on the 14th. Out here in her junior year of high school. And so exciting, but also a little nervous as well. I think we all are. So if you are experiencing some back to school, both jitters and excitement, please go ahead and send us some of your back to school pictures. You can send them to communications@tmcaz.com and put the subject as back to school, and we will share those with everyone. But if you're going back, or you've got kids or grandkids or nieces and nephews, cousins that are going back, we wish you every best wish for the new school year. And I think it's going to be a great one. And I hope that it goes well and that it's safe. In addition to bringing my daughter out to start school, I have another transition going on. I've got my son going off to college on the 22nd. So a lot of transitions in the Mendrzycki household. And I'm sure there's a lot in your households too. So if you've got anybody going back to school locally, or maybe going back to school someplace else, we wish you all the best of luck, and we hope it goes well and that everyone goes back safely. And then I put on the bottom of this, be kind, be accountable, and remember your why. You'll remember I mentioned that when I met with everybody the last time. It's something that I try to keep top of mind for myself every day. Being kind, kindness is important. And I know I went to visit Ben's Bells. I know somebody mentioned that. It was right around the corner from my apartment, so I went and visited there. Kindness is important. Kindness also shows respect. And that kind of ties back to what we were talking about with the employee engagement survey. Being accountable, also very important. Want to make sure we're holding each other accountable so we do the best for one another and the best for our patients. And always important to remember your why. I know many of you have a lot of really amazing reasons for working in healthcare and coming to TMC Health. I'd love to hear more about that. So you can go ahead and share that with me through email. Love to hear more about your why. Many of you know my why. It started with my sister-in-law, who lost her battle with colon cancer. And I think of her every morning, and it helps to connect me to why we do this every single day. The why is the patients. It's why I think we're all here. So just wanted to be able to put that reminder back on there. So it's time for questions. I don't know if anybody's got a line of sight outside, but
Jennifer,
it's looking pretty crazy out there.
I have some here for you.
Oh, cool.
Yep, we have some questions. I'll get them going here. So Sam asks, can you share what's being built over here on Glen and Craycroft? There's a fenced area. Do you know what that is?
Yes, I believe that's our neurology expansion, if I'm not mistaken. Alex, am I wrong about that?
You are correct.
Okay.
Yes.
Right.
But that's a great, thanks for the question, Sam, because someone else asked me that question about 2 weeks ago. And it's a great reminder that we can always improve in communication. So we'll make sure to get a notice out to everybody, because you're not the first person to ask that question. And it's just a great reminder of things that we take for granted because we know about them or we see them. Not everybody does. And so it's a great opportunity for us to do a better job of communicating with everybody about what's going on across the enterprise. So we will get something out to everybody so they're aware. Thanks for asking the question, Sam.
Here's somebody asking a very important question. When will the pizza party be for completing surveys at 100% in your department?
So Alex, you were talking about pizza earlier. When's everybody going to get their party?
Yes, so we are targeting for August to roll those out. And so that starts tomorrow, right? So we'll start organizing over the next 2 weeks so we can get individuals their pizza. We had quite a few who were at that 100%, a target and met it. So congratulations all. More to come. Thank you.
Awesome. And then Dan Gibson, Director of Communications, reminds people if they have any questions about Service Pin, that they can send an email to that same email address, communications@tmcaz.com. Invites and save the dates went out to people that are being honored for their years of service, 5, 10, and up. So any communications@tmcaz.com. The bridges, we often talk about locations in terms of their names, but somebody asked, where is the bridges?
That is a very good question. I'm sure I knew it at one point. I'm not 100% sure myself. So if anybody on here knows where the bridges is, if not, we will be certain to put the actual location on there.
I believe it's at Keno and I-10 area. Is that right?
That's right.
Right?
That's right.
So that's just a reminder, Jennifer, we often talk about locations that we can do that too. So the bridges, and we'll have some further announcements on internally when that opens.
That's a really great reminder too, because as a new person, for myself, when people mention locations, I have to do a little research to figure out exactly where they are. So thank you for that.
Deborah asked, how are they going to do birth certificates at Rincon when they open?
So very good question. I probably will defer and ask for a little bit of advice. I don't know if I have Mimi on here, but I'll ask one of our other executives to get us information on that. My experience with birth certificates is that they're done electronically through a system online, usually issued by the state, and the state has an online system, or at least that was the practice back in New Jersey. But certainly we will get you more information as to how birth certificates will be generated.
Great. And then Deborah also then asked, are more birth recorders being hired at Rincon Hospital?
Also a very good question, and I think it's a great follow-up to the first one, Deborah. So we'll get you some more information about how we're doing that out there.
Gary Karchner wants Alex to share his favorite Tucson pizza place. Gary Karchner in Benson. So we'll get that. Here's somebody asking, is Rincon occupancy on track?
So we certainly have seen an uptick month over month in the volumes that have come through, not only the ED at Rincon, but also inpatient at Rincon as well. We are not still yet at where we need to be from a budget perspective for what we budgeted for Rincon. So we are working actively to try to make sure that we are able to meet the budgeted numbers that we had originally put in place prior to Rincon opening. One of the things that we also want to make sure of is that patients who are seen in Rincon, to the extent possible, are treated in Rincon and then are able to go home from Rincon. I know we've had some patients transferred to TMC, the main hospital. And that's fine, because if there's a level of care that's necessary there, that's absolutely definitely where they should be. But I think there's opportunities for more opportunities to be able to care for patients out in Rincon and keep them there, which I know makes patients very happy because it's close to home, and that's the reason why they went there. But thank you for the question. Maybe what we'll do is we could do a little bit on Rincon at our next town hall. I could have Heather Beck come and give a little overview of what's happening out there. It's probably really timely because it'll be close in time to when we open labor and delivery out there in October. So Heather could come and give a little update on some of the metrics that we're tracking on Rincon, but definitely month over month improvement, which is good to see, both from emergency department standpoint and from inpatient, but not yet from the inpatient standpoint at where we thought we would be by this point in time.
Lane asks, is Benson Hospital on Epic? And if not, are there plans to get them on Epic?
So Benson Hospital, to my knowledge, is not on Epic yet. We are moving to try to get them. I know there's been movement around Northern Cochise and Benson, getting them both on the platforms that we use in other areas of TMC Health. And I think it's important to do that, not only for sharing of information, but even just to allow everybody to be able to communicate and see all of the things that we have posted on our intranet, which I know Northern Cochise and Benson can't see yet. So probably more to come on that, but that's where we're headed.
And then somebody asked why we're on Zoom today and why aren't we on Teams? And I'll say that that's fully the intended move is to move to Teams. We are practicing getting the entire system to be able to connect, and we're doing some things in the background to practice that, to be sure that everybody in our outlying areas can join. So this one we wanted to do on Zoom until we worked out the kinks with Teams. So that is the plan. And so stay tuned for more information on that.
And I see Dr. Lee very helpfully chimed in, and I appreciate that, Dr. Lee. So if you haven't seen the question and answer section, he commented that site visits will be happening over the next few months at Benson for planning for system-wide conversion to Epic.
Lots of people telling us that the Bridges is in the Tucson Marketplace.
Thanks, everybody.
On I-10. And it's next to Costco. So let's see, there's one more question, and maybe this isn't Alex. Why did TMC change the absentee policy to each day you're out, it counts as an individual day? The policy used to be, if you're sick for 3 shifts, example, then it was a different rate of counting those days being sick. The change doesn't seem logical, and somebody wants, if they could get an answer, maybe we can answer this offline. If it's more detailed, we could do that too.
Yeah, Tim, this is Alex. It is a detailed answer, but just at the very high level, the UKG system that we moved to allows us now to be able to look at each individual absentee, occurrence and be able to, record that and follow, because before it was variable and it charges 1, and we had some people that were maybe 3 in a row, some 5 that were current 1, and some 7 and 10. So it's really a tracking and data component, but if it has some negative effects, we'll want to follow up. So I took Mary's name down, and I'll follow up with her so that we can find out if there's anything else that is part and parcel to that.
Great.
Thanks, Alex. Appreciate it. And I appreciate the question.
don't see any other questions, Jennifer. Somebody asked about vegetarian dinner. It's my understanding that there will be a vegetarian dinner at the service pen. If you have questions about Boots and Bling, you can reach out to our team at Northern Cochise and ask as well. But I don't see any other questions, Jennifer. I think we're good.
I don't see any either. All right. Well, listen, everyone, I thank you so much for attending and for asking such great questions and for participating. And I hope you all have a fantastic remainder of the week. And for those that are starting school, good luck. I know you'll do well. And thanks for joining. Again, really looking forward to seeing all of you as I'm out and about. Have a great day, everybody. Take care.